Yeah, Judy, thank you. And I can't see everybody, so you'll either have to chime in with your voices.
I'll second. It's Fabio.
Thanks, Fab. All in favor or oppose? It'll be easier for me that way, and so nobody opposed, so we'll move forward. I want to take this opportunity also to welcome Mark Ferrari, a new provincial appointee, just appointed to the board. And so I want to give it an opportunity here to welcome Mark to our board. Update. We'll go to Dr. Nazateri to give us a COVID-19 update.
Board Chair, Mr. McNamara, members of the Board of Health, colleagues, thank you for giving me the opportunity to make some remarks today. I wanted to comment on three things. And the first is that when we look at the indicators for COVID, some indicators suggest a decline in disease activity, some are more static. I think to be cautious, we should continue with considering we're sort of at a steadier state with COVID, perhaps a little bit better, but I think we have to wait and see how the data progresses over time. Secondly, I wanted to share with you that we are seeing cases of influenza, the flu, and we have 14 documented or recognized cases of the flu. We only test a small proportion of the people who actually have flu-like symptoms. So my guess is that there's more disease activity related to the flu. In part, that is likely due to the fact that some public health measures were relaxed. In previous seasons, we've had little flu or no flu because of masking and other public health measures. I think we're sort of in uncharted territory that we're having more of these flu cases now come in May, and I think we'll have to monitor the burden of respiratory illness as well, related to COVID, but also related to influenza. I wanted to spend my time today just to comment a little bit on long COVID. So what does long COVID mean? Now, long COVID implies that people who get infected with COVID have symptoms that persist for more than one might expect clinically. We know that people who have more severe COVID disease are more likely to have persistent symptoms. So if you went to an ICU and were admitted to the ICU, it only makes sense that it would take a longer period for time for you to recover, and perhaps you have a longer period of time with residual symptoms. But as it looks now, I think the data would suggest that perhaps 5%, 10%, 20%, and we have to wait for the data to come out. But I think a number of people will have persistent COVID symptoms. What do we mean by persistent COVID symptoms? It means symptoms that presented when the person had COVID will continue on, or symptoms a person had before that they have COVID, got worse when they got COVID, will continue on after the COVID episode resolves. What are the common symptoms that people with post-COVID phenomenon might have? And in preparing for this report, apparently there are 200 symptoms people impute to post-COVID phenomenon. But some common ones are fatigue, shortness of breath, persistent cough, mental clouding, or people talk about brain fog, difficulty concentrating. Some people may suffer from psychological impairment or some component of anxiety related to getting COVID again. There's a plethora of possible symptoms that might persist. What can we do about it? Well, I think that like anything in clinical practice, we can always study it and learn more about it on a population health level. But if patients have symptoms, they are going to be managed by their family doctors. And if their family doctors feel it's appropriate, patients will be referred off to specialists. For example, some people with post-COVID phenomenon have persistently elevated heart rates. And the right specialist for that would be a cardiologist. Investigations could be ordered as appropriate to investigate that. What's the optimal way to manage complicated things like post-COVID syndrome? In my estimation, it's best to have a multidisciplinary team, a dedicated or focused clinical program where people with post-COVID symptoms can get timely care and be seen by the right assortment of specialists and get the right investigations. recognizing that many of the complaints will be difficult to treat. Is post-COVID phenomenon a real thing? Well, I think it is. I've been asked that before. There was a recent study in Nature, which is a pretty prominent journal, and it demonstrated pretty clearly that at least some people who get COVID end up having changes in their MRI in their brain. One can surmise from that COVID, at least for some people, causes longer-term sequelae or longer-term impairment in their brain. Why is this important? Well, I raised it today at the Public Health Service and this Board of Health meeting is ultimately the Public Health Service has a goal of trying to make sure that people who are sick get treatment, people that are sick are minimized with their disability. But at a population health level, in the aggregate, this may turn out to be the parallel pandemic or the secondary pandemic, where we'll have a whole number of people who are impaired and cannot function properly. Ultimately, the goal of the Public Health Service is for all residents, all people, to fully live to their full potential in work, in home, in family, and in all the domains of social participation. And one of my concerns, and I think a reasonable concern of many public health clinicians, is this added burden of COVID-19 is something that we have to plan for and try to formulate a management plan for. Thank you so much for allowing me to comment today. We can't hear you, Mr. McNamara.
26 months and still got to unmute. Thank you very much, Dr. Nazatiri. Questions to our MOH? Yes, Judy.
To the doctor, through the chair, thank you. I'm just wondering, is there any information yet on the long haul post-COVID symptoms and vaccination or severity of the initial illness?
Yeah, I think that the general belief today is that if you're vaccinated, you're less likely to experience long COVID symptoms. And you know, from a clinical point of view, medicine is in part science and part judgment and part an art. We know that if you get vaccinated, that you're less likely to have severe COVID and you're less likely to be hospitalized and less likely to die. So from that inference, one would think that if you are vaccinated, you're on average are likely to have a milder spectrum of disease. But if you have a milder spectrum of disease, it only makes sense that you're less likely to have the long-term sequelae of COVID. It is one additional reason why I would recommend people get vaccinated and remain up to date on their vaccination is that if they do get infected, not only are they less likely to suffer the worst consequences of COVID, but it may have some effect on mitigating the chances of long COVID symptoms. I hope that provides a sufficient answer.
Yeah, thank you.
All right, anything further on any questions to Dr. Nazatiri? Hearing none, then just a motion to receive the report. Thank you, Judy, and supported by Reno. All in favor? Opposed, if any, that's carried. Thank you. All right, move on to the 6.0, the approval of the minutes of the regular board meeting of April 21st, 2022. If I could have a motion to approve the minutes as presented. Folks will have to speak up. All I see is dots with initials.
Judy, I'll move it.
Thank you, and supported by Judy. Thank you. Any errors or omissions? Hearing none, opposed? None, thank you. Some minutes are approved. Business arising, 7.1, the Alpha AGM virtual, and Nicole.
Yep, so just an update. The virtual AGM is June 14th, so it's just one day and still held remotely. As well, we shared information about the Alpha Fitness Challenge. So again, just a reminder, and I think you received emails that the goal was just to get up and move for 30 minutes sometime this month. So hopefully you all achieve that goal, and we'll share that update at the Alpha AGM. At this point in time, we can still register if people are interested in attending. I will be in attendance as well. Our new board member, Mark Ferrari, will attend, which will be great. It's a nice orientation to public health. And this, of course, will be the meeting where there are resolutions for Alpha that we will have the opportunity as a board and health unit to vote on. Each member that attends is allowed one proxy vote for an absent member. And so I'll just maybe take a minute, again, so it'll be at this moment just myself and Mark Ferrari, who will be voting on behalf of our health unit. And there are only 3 resolutions this year. Makes sense given it is a public health conference and we've all been quite busy with COVID. But there is a resolution. Most of them have been supported already by our health unit. So there is one related to race-based inequities in health, which our board has previously supported that resolution that came through another health unit. As well, there's a public health modernization in COVID-19 resolution put forward by Peterborough Public Health. And this is related to ensuring that there still continues to be local autonomy for public health units and the significant impact of public health and recommendations around modernization. And I believe our health unit that has come forward, and we've written similar letters in support of this vision. And as well, there is a resolution related to provincial cooling tower registry for public health management of Legionella outbreaks. So those are the 3 resolutions for consideration. And so we'll follow up in email to all of the boards prior to the AGM for any members that are not attending, and just get agreement on those members that are attending on your support for the resolution as we go forward.
So any questions to Nicole? Just have one, Nicole. I freed up my June 14th. My calendar is free that day, and I will, if you can direct Leanne, and for the registration, I will attend.
Great. It's 2 more votes.
There you go. So no further questions. Business arising on next. There's 2 items here on our bylaws. Nicole and Lori, I think 2 bylaws, 7.21, 7.22. It's bylaw number 2, bylaw number 3. One is to deal with finance, and the other one is management of real property.
Yeah, so I'll just start and I'll quickly turn it over to Lori. So just a reminder to the board, we are in the process of updating and bringing forward changes to the bylaws. It's a slow process. As you know, our bylaws are extensive. In consultation, in some of the changes, we had proposed, if you remember, splitting up the bylaws. Right now we have one large, massive bylaw and splitting them into parts so they're more manageable, easier for review going forward. As well as incorporating some of the updates that are necessary, even related to the updated standards. These are for information only, so they're just, we're presenting them to you for review questions. They'll be brought back for formal approval once we've gone through all the bylaw changes, and we'll bring it back as a final document to approve. And you'll have the opportunity, obviously, as a board to officially, repeal our old bylaws and then adopt all of the new ones. So just wanted to make sure that that's clear, and I'll turn it over to Lori. She'll just explain the changes. I know they look quite drastically different than our previous version, a little more simplified. And these have also been reviewed already through our legal counsel.
All right, thanks, Nicole.
All right, thank you. So first, with our finance bylaw, which is located on page 5 of your package, there's a few key changes I'd like to highlight. So firstly, it is a consolidation of really the finance related items that are found throughout our current consolidated bylaw. So for instance, the topic of remuneration of board members was previously included in a separate section apart from the finance bylaw, and now is consolidated therein. Secondly, the finance bylaw addresses some gaps from the current bylaw. So for instance, it addresses the topic of user fees, and that is currently not in our bylaw. There's a transfer of policy type language from the bylaw to policy. So if for board members, if you recall, there's a lot of procurement policy type language in the context of our current bylaw. That language has been transferred out and is now resides in our procurement policy. And there is reference to procurement in the finance bylaw to that policy. Lastly, there is in several instances within the proposed finance bylaw, instances outlining accountabilities for policy review. So for example, the procurement policy would be brought back to the board every 3 years for review and approval. As it relates to the management of real property bylaw number 3 found on page 9 of your package. Currently, within our consolidated bylaws, there is a very brief mention of certain aspects of the bylaw, and namely around the procurement pieces and approvals. The proposed bylaw more wholesomely outlines management's, or in particular the CEO's, responsibility for care and maintenance of all properties, ensuring properties are in compliance with applicable lease agreements as well as laws and requirements. And it delineates the responsibility for maintaining and adopting policies with respect to the acquisition, sale, and disposition of property. Are there any questions through the chair?
All right, any questions? It's a matter of coming back with resolutions to deal with those 2 items. I don't see anything there, Nicole and Laurie, at this stage here in questions. So then I'll ask the board then just to receive the business of RISE 7.1, 7.2 on the agenda.
Tracy Bailey.
Thank you. Support?
Judy?
Judy, thank you. And any opposition? Hearing none. Okay, thank you. So we'll then move on to the consent agenda. We do have 6 items. If I could have a motion to receive the 6 items, and then I'll see if there's any information that certainly the directors want to highlight in their report. So a motion to receive the consent agenda. Okay.
I'll move, Gary.
Thanks, Bob.
Supported, Reno.
Thank you, Reno. All in favor? Opposed? Carried. Is there anything in those that certainly directors want to highlight? Okay, it's pretty self-explanatory on those. Resolutions, excuse me, 8.21, 2022-23 budget for programs funded by the Ministry of Children, Community and Social Services. Lori, that's on page 22 of your package.
Yes, so on page 22 of your package, we have the Ministry of Children, Community and Social Services budgets. This includes the Healthy Babies, Healthy Children's program, as well as our pre and postnatal nurse practitioner program. The programs combined support 25.75 FTEs for a total budgeted amount of $2,894,941. This approval is similar to prior year's funding approvals from the Ministry of Children, Community and Social Services. The composition of the FTEs as presently stated in the 2022-23 budget is similar to the composition in the 2019-2020 budget year. Last year, we did have a slight modification of the FTE composition to reflect the changing demands of COVID and the impact that had on our nurses. So we're looking for a approval from the board for the budget for the 2022-2023 year for total budget expenses of $2,894,941.
All right, thanks, Lori. Questions or comments? All right, hearing none, then we're looking for a motion to support the recommendation from admin.
So moved, Reno.
I'll move it.
Okay, well, is that Rob? Reno moved?
Gary Kashak, support.
Oh, thank you, Gary, and support. On the resolution, anyone oppose? That motion carries. Thank you. All right. So we'll move on now to new business. 9.1, the 2022 budget approvals. Nicole and Lori.
So I'll just start. We did receive our 2022 budget approvals through the ministry just beginning of May, and we have had some opportunity to seek some clarification on a few items as well. On our budget, Lori's just going to go through a few quick slides. We just want to be able to share with the board our approval versus what our board approved, and I'll walk you through that briefly.
Okay, thank you.
I'm just going to share my screen. And I'm going to adjust my view so I can see you all. So as Nicole stated, our budget approval came May 2nd, just 2 days prior to the writ dropping on May 4th from the Ministry of Health. And so I'll walk you through each slide and each line of the slide. So the first line of our slide is our mandatory programs budget. The approved allocation for 2022 is $60,141,500. Our request, as brought forward to the board in November of 2021, was for $16,301,231, roughly a 2% increase over the 2021 approval. So we have a variance in what we requested versus what we received of $159,731. We understand that the Ministry of Health granted all public health units a 1% increase in their base budget allocations from their 2021 approvals. Under MOH, AMOH compensation initiative, the approval is a standard $28,200. However, you, as a health unit, you are required to apply on an annual basis based upon your circumstances with your MOH and certain specifications or qualifications that they have, and you'll be determined and assessed to be eligible for certain stipends under that program. The Ontario Seniors Dental Program. If you recall, in the November budget, we had increased our budget ask by $706,700 from what was a $1.6 million approval in 2021 to $23,081,400. We were successful in getting that request from the Ministry of Health, and that is truly a recognition of the fact that there's been an increased demand for the programs and services within our community. On this next slide, I'm going to talk through the one-time funding approvals that were given to us in the current year. So there was an appeal made by our health unit, and much the same as other health units, regarding the cost sharing and mitigation funding. As you may recall, mitigation funding was only supposed to have been in place for 2020 and 2021. The Ministry of Health approved 2022 extension of the cost shared mitigation. For our health unit, that represents $1,260,800. Additionally, we understand that the Ministry of Health provided all public health units with needle exchange program funding for the current year of $19,000. So it was not something that we had put forward a request for. However, we did receive, and this is to support the acquisition of needles, syringes, and any disposal costs. Public Health Inspector Practicum Program. We as a health unit put forward a request for 4 public health practicum students amounting to $10,000 per student, and we were successful in receiving that request. COVID-19 vaccine program. In November, and then subsequently through an amendment in February through the Board of Health, we had budgeted and requested $5,348,120. We received an approval for $3,738,600. As a caution to the board members, this is not to say that we are not being funded for additional costs associated with COVID. The Ministry of Health in 2021 and took a similar approach in 2022 approved a prorated percentage of the initial budget asks, such that they were trying to accelerate cash flows to each of the public health units. So as we did in prior years, and we will continue to do in the current year, with each of our quarterly reports, we will report our actual and forecasted costs associated with COVID vaccine and COVID general. And the ministry will look to adjust cash flows and approvals in subsequent throughout the course of the year. School Focused Nurses Initiative. This was an initiative that we did not have any information on in terms of whether it was going to continue in the current year. We understand that the School Focused Nurses Initiative has been continued into December 31 of this year, and this is the funding that's to support that. The next two lines represent a total of just over $600,000 worth of approvals for the temporary retention incentive for nurses. As you recall, the government announced in March of 2022 a retention payment of totaling $5,000 to nurses to be paid at 2 points during the course of the 2022 year. This last slide talks about the approvals that we did not receive. So as you recall, we had put through in our annual service plan a request for $128,596 for vector-borne diseases. I will remind the board members that these dollars are accounted for already in the mandatory budget, and we had made this request in an effort to take pressure off the municipalities. Capital allocations, we had made a request of $955,987 to support certain capital leasehold improvements on the future CTS site, and as well furniture acquisitions in preparation for the new Windsor office location. Additionally, we put forward a request of $2,671,524 for recovery efforts within our community. And lastly, we put forward a request for CTS operating costs of $655,197. And it is our understanding, based on discussions with the ministry, that at this present moment, there are not dollars available for approval. However, subsequently and during the course of the remainder of the year, there could be other opportunities for requests for extraordinary costs with the Ministry of Health. So next steps.
Before you go there,
Yeah, certainly.
or before I lose my train of thought, when you go,
Absolutely.
you talk about the school funding nurses at 1.4 million. Is that the additional 20 nurses that were given at the beginning?
It was 19 nurses, yes.
Yeah, and so what is the risk moving forward, you know, in 23 or 24, if that funding disappears? Now, all those nurses, is it on just a standard contract, you know, year to year, or are they employees, you know, of the unit, and we'd have to make allocations, obviously. It's pretty hard to find another 1.4 million if that's dropped off next year.
So I can speak to that. When that funding originally came, many health units, every health unit did a little bit differently because of the amount of recruitment we were doing at the time and the number of nurses, and our anticipation that it would be extended. We posted 19 permanent positions. We also knew, and so I think originally that was in 2020 when we had those 19. We also knew over the course of the pandemic through leaves and retirements and et cetera, that in the end we felt that we would probably, you know, balance out. And so I can tell you that has happened. We've had retirements over the course of the pandemic, and some of those we have not filled, knowing that we had filled a large number of nurses associated with that additional funding that came in. It was originally, we were told it was ending in July of this year. It's been now extended till December, and we'll see if it does actually go beyond and into 2023. But if it doesn't, you know, there could be risk, I suppose. But yeah, so we're looking through leaves and attrition to, you know, at the end, we would be at the same amount.
Okay, thank you.
All right. So under next steps, as some of you may recall, our COVID general and COVID vaccination costs First need to be funded by mandatory programs to the extent of our total approval. And then after those dollars have been expended, we would get one-time money for that. So we need to now look to reprioritize mandatory program funding to address recovery costs, our CTS operating costs, and our capital costs. Additionally, we will be looking to use other funds to support our capital costs. So, for example, our future capital funding opportunities. During the course of our discussion last week, myself and Nicole did update the ministry regarding us moving forward with our Windsor office redevelopment project and the need for capital funding to support any leasehold improvements for that project. So they understood, and they too have been communicating to the Health Capital Division our requirements. Secondly, we're looking at our mitigation funding, and that is actually, if I can, I'm going to stop sharing my screen for a moment so I can switch my view over, and then I'll start sharing again.
Just while Lori's switching her screen, just to clarify our next step. So you'll notice that we had COVID dollars allocated. We didn't receive any of those as of yet, which means for our Q2, and we've let the ministry know, you'll see a significant change because we'll be using more of our mandatory dollars to fund our recovery efforts, CTS, et cetera, which means our expenses to COVID response will increase, and then that fund will kick in.
And the ministry was comfortable with that approach, and it's actually that is their recommended approach as well. So I have before you a resolution for your consideration. And the issue is as follows: that the Windsor-Essex County Health Unit proposes that it retain the 2022 mitigation funding to support costs to be incurred on account of the Windsor office redevelopment project. By doing so, the WECHU will reduce the burden of the cost of leasehold improvements on future operating budgets. And as you recall in the backgrounder, the purpose of the mitigation funding was to reduce the impact of the change in the funding model that resulted from the April 2019 budget announcements from the province of Ontario. Not only did they shift the mandatory program percentages from what was 75-25 to 70-30, they also took certain of the related mandatory programs that were previously 100% funded and also brought them to a 70-30 cost share model. This mitigation funding was put in place to help reduce the impact and burden of the municipalities on for those contributions for that very specified period of time. We've expressed the need to the Ministry of Health to access capital funding. They understand, but given the circumstances with the writ currently in place, there is no opportunity to seek capital funding in this particular time frame as they're waiting for the election, and likely for shortly thereafter the election as they put whatever government in place. We thought it prudent to make a recommendation that we retain these particular dollars for the 2022 year. How that translates from a budget perspective, just to remind board members that when we assign or when we provide the contributions to each of the obligated municipalities, it is the gross contribution, and it is only until after year end where we have determined and confirmed that we have met the eligibility requirements that we retain those dollars. So that is the motion that's put before the board today.
Okay. Any questions or comments, members of the board? Okay, so no questions. And if I believe that we need to support this motion. Obviously, I think it's important for us to find a proper home. And then when we look at the government is very conscious of finding efficiencies, in all of our operations, whether it's a municipality and others. And there's no doubt with the type of facilities where we're at right now, and there's certainly efficiencies to be found in a new, improved environment, in particular with all the additional requirements, especially on the dental program that's been added. And so we can't keep piecemealing, certainly our facilities. So I think it's something that we need to to continue to lobby, the ministry, and so that we can put forward a more efficient delivery of service, for our citizens. Okay. Okay, moved by, I see one hand, Joe Bicchetti. And do I have support?
Support Reno.
Thank you, Reno. If then no further questions or comments on the proposed motion, then I'll call a question. Opposed to the resolution? Hearing none, that motion passes. Thank you.
Thank you.
All right, thanks, Lori, for that report. Okay, so we'll move on to whistleblowing policy. Nicole, 9.2.
Yeah, so for those members who have been with us for a long time, you'll recall this is a policy of our board and adopted jointly by the Board of Health and the Chief Executive Officer, and was originated in 2017. We have just updated it. It is to be brought back regularly to the board for review. Again, the only changes that we made were updating some titles. So it previously identified the manager of HR. We don't have a manager of HR, we have a director. And we've actually added in directors in some of the reporting related to whistleblowing. Other than that, the policy is unchanged from when it was originally drafted by our legal counsel. And so hopefully you've all had a chance to re-review it, and we'd be looking for approval of this policy as included.
Any questions or comments? Okay, motion on 9.2 on policy. Boy, it's hard today. I don't know. It's like pulling teeth. I must be a long weekend or something coming up. Moved by Reno. Support by Tracy.
Perfect.
All in favor? Opposed? Carried. Thank you. 9.3, renewal and transformation, short-term vision for public health priorities and planning.
So I know we're in a rush, so I'll try to move quickly. I'm just gonna share my screen. All right, can you see all that?
Yep.
Okay. Hold on, I can't get the right screen. Okay. All right, so I'm technically challenged, so I'm just going to do it this way. Hopefully everyone can see it okay. All right, so this was actually an information package in your board package. There's a 2-pager, and really that's intended to be able to share with our partners. We've done a little bit of work, and this has also been communicated with the staff already, but just to talk about not using the words recovery, but really renewal, because that's what we're talking about in transformation. So as we start to move towards some additional activities, recognizing the pandemic continues, and it has been a very long time in our continuity of operations. As you know, there's services that we put offline, and some of those obviously need to start coming back, and we need to start to work towards them. So we've identified a few priorities, some health assessment as one. So again, just looking at the health needs of our community. So they would have changed over the past few years. And so doing some surveillance and gathering data to inform what our future programming may look like and what those needs may be. Addressing backlogs of services. So again, many of our services have been changed, or we're not delivering the service level we have for many years. Addressing just priority areas for 2022. So what are the things that we are going to work on for 2022? And also looking at capacity building for our staff and internally. So just talking about health assessment and surveillance, so some of our priorities and what our teams will be working on. It's in particular our epidemiologists, development of dashboards and data visualization. So I think the community has gotten really comfortable with our data dashboards, especially as it relates to COVID. So creating those for other health priorities and health topics. For obviously for our use, but also for use of other agencies in their planning to meet the needs of the community. And this includes primary data collection, but also data that we regularly have access to. Addressing our backlogs of services. So dental services, I'll be looking at catching up on our oral health screenings. We've a very important service that we deliver, and we did not do that for the past few school years. We have started to do some screening in high-risk schools for this year, so just the spring of this year. And next year, we'll be looking at expanding to all schools for 2022, 2023. And also, in particular, in high-risk schools, actually screening more grades of students, recognizing we missed many children over the past few years, and ensuring that they have the appropriate referral to a dental home or one of our HSO clinics. Vaccine. And Christy will talk a little bit more about our surge capacity, but looking at our ISPA catch-up across all age bands. So you've already heard a lot about this. So catching up on our immunizations, continuing our COVID vaccination and flu. Again, environmental health and infectious diseases. So these are obviously, we can't abandon our environmental health programs or infectious disease, but we have been operating at limited capacity and at times not doing all inspections. So we focused on high risk settings. So again, really looking at expanding within those programs and making sure we're living up to the protocols and the requirements that we have in every area. Other priorities for 2022, mental health, substance use, and harm reduction. So putting more of our efforts into these areas, and then as well for school-age children and youth. So we talked about the school nurses, so really identifying, honing in on their priority around mental health and substance, and this reflects certainly what we see as well as the needs that have been identified by our community partners. As well, our Healthy Families program. So we prioritize healthy growth and development. We're just starting to bring staff back into our Healthy Babies, Healthy Children program, and starting to, get the referrals going again, reorient that primary care providers and obstetrics to the Healthy Babies, Healthy Children program. We have to re-engage with communities so that they know that the service is available. As well, working closely with our hospitals to ensure that a screening of all moms is completed after they have babies and referring into these services. We've also are slowly increasing our support for positive parenting, and specifically, which you'll hear about at a future board meeting, Legacy, which is a new parenting program. It's an evidence-based parenting program sponsored by the CDC, as well as increasing our breastfeeding supports and referrals. Capacity building. So we are looking at introducing a standard assessment of well-being for staff, development of short-term strategic plans to inform sort of our near-term organizational direction, and we'll be looking at obviously realigning staff with our priority areas, so shifting people around. We are also looking at for this year, just for our board, some of our policies around what is a return to sort of work. So obviously we're still in an emergency plan as a health unit, but we'll be looking at a lot of that as well. And then beyond. So obviously, we're looking at our strategic plan. So our 3-year strategic plan is another area that we are closely focused on. Preparation for our move is obviously a big project and so work for us. Again, further refinement of some of our organizational processes, many of which have not been visited in a couple of years due to the pandemic, and creating plans for ongoing COVID response. And this is just a highlights, recap sort of what we've said. So we haven't really don't really have a long vision past into 2023, just looking to prioritize how we can move our next steps and build ourselves a good plan for moving forward. And I will stop sharing my screen. Anyone has any questions?
All right, questions to Nicole? No questions, then if I'll entertain, obviously, a motion to receive the report as presented.
Moved by Reno.
Thanks, Reno. Support.
That-
Judy?
Thank you, Judy. Yep, go ahead. Is this Bob?
No, I'm all good, Gary. Thanks.
Oh, okay, thanks. Then on the motion, all in favor, opposed if any, that is carried. Thank you. Okay, 2022 board self-assessment. Nicole?
I'm actually going to swap quickly with 9.5 if that's okay, and I'll Kirsty do the vaccine surge planning as it links to what I just spoke about.
Not a problem. Christy.
I'll share my screen. Hopefully everyone can see that. Just say yeah. I can't. Somebody say yes.
There we go.
Perfect.
Yes.
Thank you. Okay, great. So this is really a very short supplementary presentation to a lot of what Nicole said, showing more of a departmental approach to some of the things we're thinking about in terms of the fall and certainly until the end of this year, recognizing there's still a lot of unknowns, I think in particular as it relates to vaccination related to COVID-19 or any additional sort of vaccination as a part of a COVID response. Well, not able. There we go. So what we're really doing is looking at a surge capacity plan. So surge capacity planning, really the difference here between what we would normally plan for at a health unit is really it's a economic discussion. It's about supply and demand. So when we look at a surge plan, it's really any capacity that would be higher than our normal threshold of service. So the things like our COVID vaccine response that we have obviously been doing for the last several months, that has been a surge plan that we've implemented. And so as we look to the fall, what we want to do is look at what we've experienced and certainly lots of lessons learned. And then of course, what we see from what the evidence is pointing to for the fall and make sure that we're prepared and able to quickly pivot and respond to any of, whatever the level of response is required. So, I mean, really, there's minor plans, moderate plans, and really sort of large scale plans. The pandemic COVID response vaccination plan has really, for the last 18 months in particular, has been a major plan. It's required, an overwhelming use of resources and certainly been something from that we would say is a novel experience for us at the health unit. So obviously with any good plan, we have to make some assumptions because we certainly can't predict the future. So a couple of important key points. We would assume that the vaccine delivery channels in the province would remain the same. So certainly health units have been a big part of that. And of course, pharmacies and our healthcare providers. So recognizing that would be ongoing. We also assume that boosters will continue to be recommended by the province. There's also opportunity for additional boosters and recommendation, potentially related to the revaccination of the population or any additional booster series for new populations that aren't currently eligible. And then as well, making assumptions around the co-administration of COVID vaccine. So currently, COVID vaccine can be administered with other vaccines for individuals 12 plus. We do expect that to broaden to other age groups as we move along. So we use that assumption as a part of that. So we look for key opportunities where we can utilize a number of vaccines in the same setting. In addition, we still have the age group of 0 to 4, which does not have an approved vaccine product for COVID-19 here in Canada. We do expect that sometime this year in 2022. We also expect the use of the province's COVID vaccine tracking system, which has been a really, a nice sort of integrated way to keep the province on track and have really sort of coordinated rollout of vaccination and really is very supportive of patient care because it allows, as an example, someone to receive a first and second dose, let's say at a mass vaccination clinic from the health unit, and then attend their local pharmacy somewhere that they visit often for, let's say, a subsequent booster dose, and all of their records are in the same spot. From a staffing perspective, we use a lot of our experience, and certainly there's lots of different ways that vaccine clinics have been run here in Windsor-Essex as well as across the province. So our assumptions are really around that standard immunization format that we're used to and that our staff have traditionally utilized. Constraints, as I said, we can't predict the future. Certainly additional vaccine series and boosters are an additional unknown, as well as some of the other pressures related to possible pandemic response needs from the health unit. So really, in a nutshell, what a surge planning exercise from our end looks like is looking at a number of different scenarios that might require us to respond. It makes assumptions based on the current channels of vaccination, which, as I noted, certainly the health unit is a big part of that, but also our healthcare providers and pharmacies. Primary care providers in Windsor-Essex have administered approximately 6% of COVID vaccines here in Windsor-Essex, and our pharmacies have administered approximately 32%. Recent provincial information has indicated Windsor-Essex has one of the strongest pharmacy channels, which I think has really also helped us from an administration perspective. Certainly, it does also provide an opportunity for growth as we move forward. So this is really sort of an example if we pick one of a likely scenario, which is potentially that 40% of our eligible population would need to be vaccinated. So it really takes into consideration use of those existing channels. So how much the pharmacy channel might provide, how much the primary care channel might provide, and then certainly the remainder would be, different types of vaccination services provided by the health unit or partners such as mass clinics, mobile clinics, pop-up clinics, all those different types of clinics, and how we might account for that and plan on a week-to-week basis or on a month basis, as well as it gives us an opportunity to plan for staffing. And so really these different scenarios allow us to take a look at the varying, responses we might be required and then plan accordingly. So, of course, any good plan comes with an opportunity for growth. And certainly when we look at a focus on co-administration of vaccines for the fall, in particular, the flu vaccine as well as COVID, I think we see a lot of areas an opportunity for growth. On the left-hand side of the screen, you'll see our flu vaccination administration projections based on the channels, and you'll see our primary care providers provide the vast majority of flu vaccinations, and pharmacies certainly also have a very strong component of that. And we see, from our COVID vaccination perspective, we've got a lot of room for growth here, which is nice because it gives us an ability to focus on strengthening messages and information and education and potentially onboarding of folks to be able to offer both vaccines as we enter into the fall. So moving ahead, this is just a bit of an example of what the use of one of those planning scenarios of 40% might look like. If we were using that, we would look to potentially support 2 community mass sites for potentially a 12-week period of time, 500 doses a day. We would co-administer flu vaccine as well as COVID-19, which our mass clinics were doing during the fall and spring as well. So this is just sort of it's a bit of a supplementary presentation to what Nicole said around some of the activities that we're doing on a departmental level. So I will stop sharing my screen and happy to answer any questions.
All right, thanks, Christy. Any questions or comments? Christy's report. Hearing none, all I can say is, wow, busy times, and we've certainly come a long way since 2020, for sure. And then so you need to be commended, everyone at the health unit for, for really, as they say, grab the bull by the horn and really taking charge on that. So it's nice to see developing other partners now that can administer, and so we can do more in a more efficient manner. So that's certainly a good approach. So with that, a motion to receive the report that Christy has brought forward. Thank you, Reno. Judy, thanks. All in favor? Oppose if any? That is carried. Thank you. So we'll go back to the other item, Nicole, the self-evaluation.
Yeah, I won't bore you with a presentation. There was a report associated with the self-evaluation. So just to note that we do a yearly board self-evaluation, the competency areas. There's quite a number of them, including equity and knowledge of our public health standards. And so there'll be a follow-up to this meeting for all of you to complete via survey, as we have done in the past, your own self-evaluation, and we'll bring the result forward in aggregate to a future board meeting, and certainly board members can have their own results as it relates to the larger group as well. So happy to answer any questions, but for those who've been on the board for a while, you'll remember this fondly, and it's pretty standard.
Yeah. All right. Any questions or comments? Hearing none, then a motion to receive 9.4. Thank
Move
you,
that.
Reno and Gary Kasha. All in favor? Oppose? Carried. All right, we'll move on to correspondence. We have two. We have the Great Bruce Public Health letter to the Honorable Christine Elliott and the Honorable Michael Tabolo on mental health and addictions. And the other is the Greater Essex County District School Board letter to the Honorable Stephen Lecce and Dr. Karen Moore, and that's reinstatement of public health measures for schools. So we're looking for obviously support for those two. Moved by Reno and supported by Joe Bicchetti. And on the motion, all in favor? Oppose? Carried. Okay. Motion to move into committee. Reno, Judy. All in favor? Oppose? Carried. So Lena or Leanne, I'm just going to wait for your go ahead here.
One moment, Mr. Chair.
Okay.